Good afternoon. I'm George Latimer, Westchester County Executive, and this is the first of our two reports for this week on the Westchester Coronavirus Update. I'm joined by our Deputy County Executive, Ken Jenkins, who will be reporting on a couple of the issues of the day. Today is Monday, February 8th, and we will be back again in 3 days' time on Thursday to give you an update at the tail end of the week on some of the same topics we've talked about. Right now, where we are is a foot race. You've heard this metaphor before. It's a foot race between the spread of the infection of the disease and the degree with which we can vaccinate as large a portion of our population as we can. If we were able to vaccinate everybody, then the rate of infection would drop dramatically. If the rate of infection were to explode and move faster than we can move with infections, then we run the risk of greater, not just infections, but hospitalizations and fatalities. So right now we're dealing with these two issues at almost equal priority, and to make sure that we test and identify how far the infection has spread, and at the same time how fast we can try to vaccinate the population. And of course, these issues are not Westchester issues alone. They're issues that involve not just the New York State or even the United States of America, but the world. And there are elements of this issue that are playing out all across the globe as we speak. Our responsibility is to give you the picture of what it's like in Westchester. You're welcome to go onto our dashboard where we give you information about active cases, total cases. We have some information about the number of vaccinations that have been held. As often we've said, we'll give you aggregate countywide numbers where we have them on things like hospitalizations and fatalities. We're unable to break down those numbers into smaller increments because we need that information from the state of New York. And we're obliged to reference that it is the state of New York, as the other 49 states, that have really taken executive authority to guide everybody who lives in this state, all the businesses of this state, through this situation. We in the county government are tasked with implementing healthcare policies, public health policies that come from the state of New York and to some extent from the federal government and the CDC. Most of the time we don't create the policies, but we have to try to interpret them and then put them into effect, which creates a number of different questions that you might rightfully have about who do I talk to when I want to see something modified or changed or improved. But let's go forward, first of all, with the numbers. The tracker for today, the state tracker, is up. So we have up-to-date information that is effective as of today, Monday, February 8th. We have, as of today, 8,416 active cases of coronavirus. That is gained by the total number of positives pandemic to date of 98,445 individuals, and 90,029 of those individuals have cleared through the protocol more than 2 weeks. So that leaves us with 8,416 cases. I should point out that we expect sometime within the next week, and maybe just in a few days, we will break the 100,000 mark of total people that have tested positive for coronavirus. If you consider that our population is 1 million people in Westchester County, we'll see what the census comes out with in April, that would represent a point at which 10% of the residents of Westchester County have at some point in time tested positive for COVID. Certainly there are people that never tested for COVID, had the disease, worked through it, and so the number is probably higher than that. But that 98,000 number, when it hits 100,000, that means 10% of the population has at some point in time tested positive for COVID. The 8,416 active cases shows a continuing decline. It's a small, steady decline that's happened now over the last 2.5 weeks since we cleared the 2-week period of time after the January 1st, New Year's Day or New Year's Eve period of time. We saw spikes at Thanksgiving, spike at Christmas, and then Christmas going right into New Year's Eve. And even though we didn't have the ball drop either Times Square or here at Renaissance Plaza in downtown White Plains, people did get together in social settings, and in those social settings, the virus did in fact advance. We know that we are dealing with a more communicable version of the disease and the UK variant that is now with us, and we're hearing about other variants. Certainly I'm not capable of being able to describe what makes one element of the virus different or more communicable than another, but we do know that that is part of the race on one side of the coin, which is the speed with which the infection circulates. With 8,416 active cases, that compares favorably. A week before, we were at 10,278 cases, so that's welcome that we have 1,800 less active cases today than we had a week ago today. And if you go back 2 weeks ago, that number was 11,494. Almost at 11,500 cases, and almost exactly 3,000 less cases in the aggregate in the last 2 weeks. We consider that very good news. The number was even higher than that 3 weeks ago at 11,600. That was the peak that we had seen of active cases. Back when the pandemic began in March and April of last year, we had numbers that reached 12,000 active cases, and then it dipped down to a very low number, a few hundred, and then it started to spike back up again, starting in October, late October, through the holiday season, getting as high as the number that we had 2 weeks ago today, 11,658. So we're encouraged that number has dropped down to 8,416. We hope that active case number continues to drop, and we see it take ourselves lower and lower, which would be good news. We have tested, for the record, 1,861,152 tests, and they are obviously, by now, multiple individuals because there's 1 million people in the county. So clearly, many of us have had more than one test, some quite a few, but that gives you an idea of the extent of testing. We certainly have tested adequately and more than adequately in Westchester County. We have had 1,976 fatalities throughout the pandemic. That number is 5 more than they were last night, and the night before that there was also 5, and over the last few days the numbers have dropped just a little bit. We were getting low double-digit fatalities nightly for about 2 weeks, and every death, every individual is a serious, emotional, personal thing. They're not to be turned into integers, but those numbers have dropped somewhat over the last few days. A week ago today, we had 1,917, so that means we've lost 59 people in the last week. In the week that preceded that, we lost 66 people, so that's a very slight drop that we've seen, and the number before that was a little bit steeper as well. So we're hopeful that this slight downward trend will continue. We will see what the aftermath of Super Bowl Sunday is, because with Super Bowl Sunday being what it is, big secular, holiday for people, they do gather, we watch the big game, and there may be an opportunity for spread there. We hope that people use common sense in their gatherings, but we'll see if there is a spike that follows Super Bowl Sunday. It'll take us 10 days to 2 weeks to really get a sense of if there is a spike and if it reverses this downward trend. We hope it does not, but at this stage of the game, the news today on those fronts is encouraging, but nothing to kick up our heels about. The last hospitalization number we have dates back to Saturday. 491 individuals were hospitalized for COVID as of Saturday, 491 in total. That number compares to the prior week where we had 517 that were hospitalized. The week before that, 2 weeks ago, Saturday, 554. So the net number of people that have been hospitalized has dropped by about 10% from where we were 2 weeks ago. We're under 500 hospitalizations. There was a point in which there was a steady climb in hospitalizations. We at one point had 20, 30 people hospitalized in the summertime. And we reached a peak just shy of 600. And now that seems to be receding, we're encouraged by that number as well. So the hope is that the rate of infection will slow down dramatically, and that would be the impact of how many people are vaccinated and not going to get the disease, so that whenever there are testing, you'll have a higher percentage of people testing negative, a lower number, absolute number of people positive, and you'll see the active case number drop down. But again, all of those numbers are encouraging, and what we're seeing, if you want to do it by timelines, we are as low in hospitalizations as we were just about a month ago in January, when there was an upswing in hospitalizations. So we are now down on the backswing, and the longer we go with a dropping hospitalization rate, the more we have recaptured everything that we lost during the spike around Christmas and New Year's. And you have to go back to December 30th to get the same number of active cases. Same thing. It peaked up, and now it's on the downslope, and we hope that downslope will continue. The other statistics that we watch very closely, and in this we're really involved in more than just watching but actually delivering, is the number of vaccinations. Now, Westchester County has 3 locations that we are involved in vaccination of individuals for COVID. New York State authorizes vaccination in a number of different settings. When Ken has a chance to speak in a few minutes, he will talk about pop-up clinics, which are state-sponsored clinics that are a targeted number of units and targeted to specific areas to reach certain specific constituencies. But generally speaking, the county runs directly 2 locations now. We have run the White Plains Health Clinic for a month, round numbers, on Court Street in downtown White Plains, and we have now just opened late last week a center for vaccination at Westchester Community College. We are trying to manage, and you can imagine how difficult this is, the combination of people who need to come back for second shots either 3 weeks or 4 weeks distant from the original shot, as well as giving vaccinations to people who haven't yet been vaccinated with their first shot. So we're trying to segment those in the 2 clinics that we are directly responsible for running. We are an active partner in the 3rd location, which is the largest of the 3, which is at Westchester County Center. Now, the County Center facility is owned by the county, but we turned it over to the state, just as we did Glen Island Park back almost a year ago. Glen Island is used for testing COVID, and County Center is used for vaccinations. And the vaccinations there are significant. We can reach over 1,000 people vaccinated in a day at the County Center. So that's the single largest place in Westchester County. Some hospitals are administering vaccines. A variety of pharmacies are administering vaccines. The county has no involvement or control over what happens at those hospitals or at those various pharmacies. All of that is within the aegis of the state government. However, in the areas that we're responsible for, we have had year-to-date at the health clinic in downtown White Plains a total of 6,344 people vaccinated. We have had at the community college, which just began a couple of days ago, 560 people vaccinated, and then we have today set for another 310 appointments, so we'll count that into the total. And the county center has broken 30,000 vaccines distributed, 31,453 through yesterday, for a total of 38,668 individuals that have received vaccinations that Westchester County has been involved in, and that is a portion of the total people vaccinated. You would have to add the pharmacies, hospitals, and any other settings, the pop-up centers, which have all been established to get a total aggregate number. We don't have that aggregate number. We do have the number for those areas that we're directly responsible for. We are projected to get 1,100 vaccines from the state for this week, and I gather, because we've been effective at what we're doing, we're getting an additional allocation of 20% above that, which would be another couple of hundred, 200 or so more doses. And that aggregate amount to be given out will be given out through the county-run locations, not including the county center. So between our clinic and our community college, we'll be able to reach a larger group of people. The real question is the amount of vaccine that is available. Nationwide, there is a dearth of vaccine available for every county, every city, every state of the nation to satisfy the vaccination of all of their residents. The New York State, under the direction of the governor and his immediate team, have prioritized certain circumstances. We cover this each time we speak because there's always an addition that's been added to it since the last time we spoke. But they've created categories, 1A, 1B, 1C. What it basically comes down to this. If you're 65 years of age and older, you're entitled to get a vaccine. If you work in a number of key occupational areas, jobs that are considered essential to the structure of the society, police, fire, EMS, education, teachers, and related jobs, bus drivers, transit drivers, they're seen as necessities, and also with great public contact. Funeral directors are in that list. There are a number of categories of medical professionals, doctors, nurses, certainly. Anybody that has direct patient contact in a hospital setting or a clinic setting, they're all entitled to receive shots. Last week, the governor announced that he was adding to that list taxi, limousine, and TNC drivers. TNC would be Uber and Lyft, ride-sharing entities. He's also added to the list for eligibility restaurant workers and those that work at facilities that serve the developmentally disabled. Now, to be eligible for a shot is one thing. To also add to that number people who have comorbidities, which we're going to talk about. Ken will touch on that topic as well. In other words, people have underlying health issues. Now, they are now eligible for a shot. They were not eligible a week ago. That announcement was made within the last week and added to the list. We still have a pool of vaccines that is limited. If we are getting, just as I said, 1,100 vaccines from the state, and a 20% bonus puts us at about, round numbers, 1,300 vaccines. We have, in those 2 locations, the clinic and the community college, 1,300 vaccines that we can give out. That is our allocation. A pharmacy might be getting 500 or 250. A pop-up center might get 150 or 200. A hospital might get a certain amount. But those allocations of doses are all that we have. Widening the number of people that are eligible means that a greater diversity of people can get the shots. But in the next week, we can only deliver 1,300 shots outside of the county center. The county center, while it's in our county and is our county facility, is treated as one of the state main centers for vaccinations, and their allocation comes from a different pool, and we know that since they vaccine as many people as they do, that is a significant generator of this. The more people that are vaccinated in this county and other places, the more protected we are from the spread of the disease. If you don't get the disease, then there's no hospitalization, there's no fatality to follow. And we also know from what we've followed in the national news that there are going to be some additional products coming online. Johnson & Johnson has a product which we understand is a one-shot vaccine. May not have the same level of efficacy as the existing ones, but still we understand a high level of efficacy, over 80%, that is effective to combat COVID. We're still waiting to hear more about the AstraZeneca product. These are things that fall outside of our scope. I follow the news as you follow the news, and we learn about it from that context. And then when vaccine doses are available to the state, then the state will let us know each week how many doses we get, and they'll tell us of which vaccine it is, because that will determine, how many days we have until the second dose is required. If it does become a Johnson & Johnson product, which is a one-dose situation, that certainly makes it more convenient, and so we'd be happy to do whatever it is that those structures allow for. But in the aggregate, the 3 locations that the county is involved with just shy of 40,000 people being vaccinated, that certainly represents first shot for all of them, not necessarily the second shot for all of them because of the time lag. Somebody who just got their first shot within the last 2 weeks isn't ready yet for their second shot. But the second shot of vaccine has been set aside, so there is no question that you, if you've gotten your first shot, that you will have available at the location that you had the first shot, you will have your second shot available for you. There should be no doubt about this. There shouldn't be any speculation on Twitter or any speculation on Facebook. There probably will be no matter what we say. But we are given the guarantee to make sure that we have available the first and the second shots for each person that we have available units for. And we intend to make sure that we complete that, because we know if the second shot isn't administered, the person is not protected to the same degree as they were after just one shot alone. Now, I want to address what happened over the county center on Sunday. We have had pretty smooth operations at the county center. If you went to the county center for a vaccine at any point in time from when it opened in January up to this past Sunday, you saw a system that moved very quickly through the lines. I had more than one person send me a note or tell me verbally that they got in and out of the county center within a minimum amount of time, was smoothly operated. On Sunday, we had long lines, and of course, long lines attracts television coverage and the ability to talk to anybody standing on that line. Are you happy that you're standing on a long line? And the answer clearly is no. And I think there's some misunderstanding of what happened, so let me explain it so you understand what it is. And the speculation, whatever it is not the facts that are involved in the matter. 2 major things happened to create that line on Sunday. The first major thing was that we had the center closed on Monday and Tuesday. The county center was closed on Monday and Tuesday. If we book 1,100 to 1,200 people, those appointments had to be rescheduled and interfaced within the existing group of appointments that were already there. So if you have 1,200 Wednesday, 1,200 Thursday, 1,200 Friday, 1,200 Saturday, 1,200 Sunday, but you have 2 days that you lost all the appointments, that's 2,400 people that had to be interwoven in existing days where you had, in theory, the maximum amount of people to be vaccinated. So the efforts were made. This is handled by the state team, very efficient team, work with the Westchester Medical Center individuals and, of course, the county as well, to rebook the lost appointments of Monday and Tuesday. You can't make people who are prepared to go in, go to an end of a line that might be, weeks away. So that was interspersed, and so we pushed the system to its maximum. However, when the reports of the coming snowstorm came, people making decisions that they felt were in their best interest decided that even if they had an afternoon appointment, it would be better for them to go down and to go to the county center and be there and see if they could get their shot early. And there is still a baseline thinking that folks have that all of this is still like first come, first serve. If I get first online, I'll get something that I want. I made the analogy, in my youth, if you got online for tickets to a rock concert or tickets to a sporting event that were hot, in the days before everything was done on computers, you got online. You may have stayed overnight online. Might have been a fun experience for all you can remember. But the bottom line is it is not a first come, first serve situation. So when people who were concerned They had a 4 o'clock, a 5 o'clock appointment on Sunday, decided to come down at 9 o'clock or 10 o'clock. They wanted to get this shot early so they wouldn't have to deal with the snow. It's understandable, but it wasn't the best strategy, because what happened is you were overloaded because you were already operating above the normal capacity to handle the Monday and Tuesday crowd, and now you have people coming earlier in the day, and that created a tremendous line for most of the morning into the very early part of the afternoon. The proof of the pudding is once we started to spread out the time and go through the vaccinations, there was no line at the location by early to mid-afternoon, and the center stayed open until 7 o'clock last night. Of course, the snow started to diminish and became much less a problem at 5 o'clock, 6 o'clock, and so forth. And we were able to get literally everybody through that showed up that had an appointment. But the fear of the snowstorm that drove them early generated the long lines. And now you have people in line. Somebody's got a 9:30 appointment. The guy behind him has a 3 o'clock appointment. The next person who has a 9:35 appointment is 15 people on the line. You'd almost have to go through the line and call people out. And, of course, agitation happens when you wait a long time for things, and people obviously make comments. I saw plenty of them on Facebook. You guys don't know what you're doing, typical government, all the kind of stuff that you hear. I've lived through this for a long time. No surprise to me that people will immediately assume the worst when these things happen. But you ought to know that is what happened yesterday at the county center. Like it, don't like it, these things happen. We are all dealing in an unexpected set of circumstances. Nobody has seen a pandemic like this for 100 years. And, of course, there's no roadmap of how to do it in a nation with 330 million people as opposed to a nation with maybe 120 million or whatever it was the last time we had a pandemic. So we do not anticipate those types of lines happening for the future. So if you saw news reports yesterday and you say, oh, my God, there's going to be lines at the county center, if you get to your appointment sufficiently in advance, a reasonable amount of time in advance, you will be able to go through the system smoothly, get your vaccine, wait your 15 minutes to make sure that you're not going to suffer any shock or anything of any other nature, and then you'll be able to go about your business, come back at your second shot. They'll tell you the arrangements when you get there, and things will go smoothly and effectively. All of this structure has been set up by the state. The county is there to help and participate. National Guard members are there. If you are infirm or it's not easy for you to be mobile, you have a walker or you have somebody with you. When you get there, you can have your driver pull up to the front, call inside, and they'll have somebody come out, most likely a National Guard official, to help you get inside the building. And we'll give priority to people who are physically disabled, within reason. If someone's in a wheelchair, if someone is, using a walker or a cane and of a certain advanced stage, we will try to help that. We're not going to use this as a venue for somebody to say, I got a bed back, let me get in, and jump the line because you want to get in and get out sooner than your appointment. But this is a difficult process, friends. Ultimately, we have to vaccinate up to 1 million people in Westchester County. We don't have enough vaccines now. It's sparse. I used the analogy last week about having 10 cookies on a plate and 25 people that want a cookie. It may seem a little trivial to some people, but that is what it is. We have a commodity that's scarce, and we have a demand for it that is great, if you want me to put it into simple business terms. And we are trying our best to manage that process, given the fact that it is within the hands of the state to determine who is eligible to get it. It's not open to everybody yet. If you're 37 years old and you're perfectly healthy, you cannot get a vaccine in New York State unless you're in one of those employment categories that I've mentioned. If you're a teacher, you're eligible. If you're a firefighter, you're eligible. If you're a medical professional, you're eligible. But you have to fall into that category if you're under 65. It's complicated. This whole system is complicated. But again, we are in a race to move vaccinations as fast as we can, faster than the spread of the infection. And if we can get vaccines done, it's in our interest to vaccinate everybody that wants one and to try to get us to some point, probably in the 80 percentile range, where we have this quote-unquote herd immunity that you and I have heard about, the medical professionals have talked about. When so much of the society is unable to get the disease, then the disease has no host, and it ultimately burns out as individuals fight it off, and we get to the point where we can resume some sense of normalcy. We are optimistic. We hope that sometime before the end of the spring, perhaps during the summer at the absolute latest, we will get this thing in a position where we have a better control of it, and that by September we can start to see much more normalcy in our world. But as it stands right now, Westchester County Center, open 8, closed at 7 p.m., 7 days a week, 1,000+ people in that location. Westchester Community College and the clinic in downtown White Plains, open 6 days a week. And in each of those different cases, appointments only. Do not show up. It is not first come, first serve. You have to call to get an appointment. On the screen, they'll flash up the information again for you to follow. And we are also dealing with those occupational groups as well, the police, the firefighters, the teachers, and we're trying to deal through their sources to get as many of those people done as possible. Let me talk about schools for a second. Last 2 weeks, we talked a bit about high school high-risk sports, football, basketball, hockey, wrestling, a number of other sports, which the state determined were more high-risk sports, sports where the combatants are in close quarters with each other. They are more likely to spread the disease to each other than they are in the low-risk sports areas. And, golf is a classic one. Perhaps tennis falls into that category. Whatever it is, the governor, I think 2 weeks ago on Friday, gave the green light to do this, subject to the county health departments around the state. We immediately worked with the other counties in Section 1, which is the athletic conference that Westchester Public Schools are in. We work with Rockland, Dutchess, and Putnam counties, and we gave a green light about 4 or 5 days later to do this. And then we had some implementation documents. When those documents came out, individuals in different schools said, oh, my God, this is going to take too much time. You're going to delay the season. Well, no, it doesn't. We went through a clarification process to make sure that everybody understood what it would take to satisfy the protocols in order to play. And the purpose is to protect the athletes, to protect the coaches, to protect the parents, not to slow down the season. We gave a green light to have the season. We want to see sports occur. We know it's important to the youngsters who play it. I played high school sports myself, not particularly well. But the bottom line is that I understand what that experience is like. And my daughter as well when she went through high school. So it was an attempt to try to satisfy standards that the state has created to make sure we have a healthy operation. And we believe we're in the right path now and that each of these different schools are moving to move forward in high school sports. Immediately upon dealing with that issue, the larger issue of whether schools can open for educational purposes came up to the top of the list. Every Monday morning, we have a conference call with some number of the 44 school superintendents in the districts around Westchester County. A couple of them overlap with Putnam County. We covered some of these things today, and I want to just cover them with you so that you understand where we are. First of all, as a matter of principle, my position, our position as administration, is we would like to open schools in a safe fashion so that kids could go back to in-school learning. We think that is the best way to convey the education. We're concerned, although we're not directly as a county government involved in the education process. That goes from the school district to the state. But I previously served as a state legislator. When I was in the state Senate, I had the education portfolio as a ranking minority member. And it's clear to me that the best possible education that we can give our young people are in a classroom with qualified teachers and in a setting that is devoted for learning. The remote learning is an example of trying to maintain a learning module even as we try to protect people from the spread of the infection. School districts were given the option to go remote, to go a hybrid, sometime in the classroom, sometime out of the classroom, or to go back in fully. But they were given certain guidelines as to how that would happen, and those guidelines can be difficult to meet because not every school district, not every school building has a certain physical nature that allows for the kind of social distancing that has been recommended by the state. But let's be clear, the guideline is established by the State of New York Health Department. The county health department's job is to implement it. Every school district had to put together a plan. The local officials diligently put their plans together, submitted it to New York State. They saw the plans. We in the county did not. And at that point forward, as they implement their plans, they deal with getting approval from the state to take any other changes in their plans and ultimately to open fully. Our job as a county government is to help them do that. We are trying to help them by getting sufficient test kits to test for COVID, because every one of these plans requires you to test to make sure who has the virus so they can be isolated or in some cases quarantined if they've been exposed to it, or to show that there's a negative test result, and then individuals can continue on with their activity. So we're responsible to be helpful in that fashion. We've also taken on the responsibility of working with school districts to vaccinate all essential school personnel. And that certainly means teachers in the classroom, and it means those who may not be teachers but are in direct contact with students and with the bulk of the people that operate in the district. And that certainly would be cafeteria workers, maintenance workers, a host of individuals. We are working with the various unions and the various school districts to try to identify how many individuals in each school district require vaccination so that we can target what percentage of the vaccine doses that we get to make sure, just like we make sure that there's so many police, so many firefighters, EMS, that there's also a significant number of teachers to get us to the point where, along with the distancing standards, that schools can open. And obviously, if we had all of the vaccine we needed, we'd be running vaccination 24 hours in 10 different locations, and we'd get everybody who wanted a vaccine through. And if you wanted the vaccine bad enough, I know if I did, I'd go get it at 12 midnight someplace if that was when I had to get it. We are in the process, however, of trying to work through the state guidelines and determine if we can, in the way each school district handles the physical implementation of these guidelines, a way to help them qualify so that if they're prepared to, that they could open back up. But it is not the county government that makes these decisions, and it's important for you to know that. Someone will say, oh, you're blaming another level of government, you're throwing these other guys under the bus. No. If we have the ability to make the decision, we'll make the decision. We made the decision to open golf courses last year and conduct Bicycle Sunday. We have no problem. We opened beaches and we opened pools. And when given the authority to move forward in high school sports, we said, yes, let's move forward. But in every one of those cases, we didn't do it blindly. We made sure that there were certain protections in place. Even for golf, the sport itself is socially distancing. But we restructured the way you interacted with getting tee times. We restructured the way you function if you go into the pro shop. We made sure that you had one cart per player rather than two guys in a cart where the potential for virus spread came. So we made changes in the way the sport was conducted to allow it to go forward. And that is the same thing we've done with high school sports, and now that is the same thing we're trying to do with schools. We're trying to make sure that if they can open, if the local decision makers say, yes, we're ready to go, if we have teachers sufficiently vaccinated and we have sufficient spacing for classroom settings, that we can go forward with it, that you can have confidence that there will be as safe an environment as possible. And that is exactly what we're striving for. So we're following state guidelines, but we're trying to implement them to the best of our ability. And if there's any questions on this, I'll certainly answer any press questions, and we're certainly happy to talk with any individuals in the community. But you must understand there's a lot of dialogue out there that isn't rooted in the things I've just said to you. If you have any questions about what I've just said, you're welcome to reach out to me. We'll respond back. You can reach out through Catherine Chaffee, communications@westchestergov.com, and we'll provide you whatever information you want that. We want the schools to be open. We want them to be safe. We want to give the local school superintendents the ability to open those schools appropriately. We want the teachers and the other staff to feel like they can go back into school in a safe fashion, and that the parents can send their children to school and know that those children will be safe. That's the mission here. There's a situation, as I've said before, that the state has targeted different occupations, and we are trying to get information that will enable us to address those occupations by workplace rather than just you're now eligible, get on a queue line and find out that your vaccine isn't coming until April. You're welcome to do that. And if you have a cousin who can get your vaccine some other place, it's fine with us. We don't care as long as you're vaccinated. But from our standpoint, we are working with police, fire, EMS, teachers, and some of these other categories to try to get people in. And by going to a school district and saying, can you identify for us how many people need vaccines? And now we try to time and target when we can get those people through the system. If we can do those things, we can open our schools and we can have another step back in the right direction. Now, in addition to what we're doing in those 3 locations for vaccinations, and I've mentioned already that the state has authorized pharmacies and hospitals to have vaccination environments. The state has also identified temporary vaccination areas that have a limited amount of time, and they are called pop-up locations. I don't know who thought of that phrase. It makes it sound too casual to me. I just say they're temporary vaccine locations, but they're called pop-ups. And Ken Jenkins, our deputy county executive, has been involved in this. He and I both have gone out to see the ones from this past weekend. I want Ken to give an update and a report. And then when he's finished with that report, he's going to talk a little bit about the issue of comorbidities, or people who have other underlying illnesses, and how that relates now to their eligibility to get a vaccine. Ken.
Thanks, George. As the county executive mentioned, Last week during the press briefing, Governor Cuomo announced the details of the New York Pop-Up Initiative, which is going to consist of 300 free pop-up locations across the state, and that plan is to do those over the next 100 dates. There were 3 pop-up locations in Westchester County last week, one in Mount Vernon, one in Peekskill, and one in the city of Yonkers. We certainly want to thank the governor and for all of the work that's been done. County Executive Latimer, all of the state legislative delegation, your assembly person, your senator have all been actively lobbying to try to get more locations across the neighborhoods, across the communities, to be able to address specific targeted places, especially where the infections are high. And they had a zone previously to be able to vaccinate as many people as possible. So we absolutely want to thank the governor for working with us to try to find and locate those pop-up locations. County Executive Latimer said in a perfect world there'd be at least a vaccination center in each one of the corners of Westchester County, and that advocacy continues between the county executive, the team here with the leadership team, as well as all of the state delegation. They are all working hard, and we are all working hard to try to make sure that there are more vaccination locations. But the county is not responsible for these pop-ups at all. As the county executive outlined previously, the New York State is 100% in control over those particular locations. They work with the local municipalities, again, because the county executive's leadership in making sure the municipalities and folks are involved from a conversation perspective to at least identify the places. And they are a way of targeting specific groups. I know in Mount Vernon, it certainly was targeted to the community that was surrounding, that was getting hit hard with testing and positive cases of COVID, and certainly passing away of individuals. In Peekskill was a yellow zone, and so was Yonkers, another yellow zone, and those are going to continue. The thing is, for those sites, they went over 3 days in Yonkers. It was actually supposed to be 4, but the 4th day was moved up to Saturday because of the impending snowstorm, and that was a good call for the people in Yonkers to do that, working with the Municipal Housing Agency in the city of Yonkers. In Mount Vernon, they had 3 days that started last week on Wednesday, and Peekskill had Saturday, as the county executive was there in Mount Vernon and in Peekskill. The pop-up sites are going to continue. We do not have a list of what those are going to be for this upcoming week. The state, the governor, make sure to announce them, but working with everyone is a way for us to make sure to get as many people vaccinated as possible. In this particular ones, there wasn't any signups because people asked and called us and asked to find out how to get on those pop-up sites once they were located, but that is working with the state, and they are targeting individual communities to ensure that the balance of vaccine gets to every person and vaccines in arms, specifically 65 and older. Those 3 pop-up sites, just want to mention as well, were only limited to people 65 or older. They were not opened up to everyone who was eligible. There are 3 different paths for that, as county executive has told us throughout the weeks. The hospitals for the hospital workers and first-line healthcare workers, the retail locations, and the county center for those that are 65 and older, pharmacies being retail locations, a doctor's location, and certainly those are on our website. You can see all those locations on the website, and certainly the comms team is popping that up. And finally, for the public workers and other places that are designated, the governor has designated for those public employees for the county health center. In addition to that, the governor also mentioned and validated, finally, the comorbidity and the ability for those vaccinations to be given to folks that have certain illnesses or fighting through immunocompromised systems, but that does not begin until next week on Monday. So those do not start to the 15th. You can call the state, and there's a website that we put up that you can identify how to get those locations or how to get those vaccination appointments when that begins on the 15th. Again, the local health departments are going to work with the state as they try to roll out that particular part of the program, but the state website is your best course of action. Call in here and trying to call the health department to get appointments is not the way to make sure to get that appointment. Call the state hotline or go on the state website. Thanks a lot.
Thank you, Ken. Of course, because it is February and we do live in the North, and I've lived in the North, not just in New York, but in some other states all my life, it snows. In case we missed that fact, we were reminded twice in the last week with a very heavy snowstorm a week ago that lasted an exceptionally long period of time from Sunday night into early Tuesday morning, leaving double-digit up to 20 inches in certain locations. And then we were blessed with another snowstorm that came through yesterday, quicker, not quite as impactful, 6-7 inches, I think, were the peak in most parts of the county that had high accumulation. We are seeing on the weather report more storms ahead of varying sizes and scope. There's one, we think we have a weak low moving through the region tomorrow. We don't know what that'll do. The estimates tell us we may get 1 to 3 inches along the coast, 2 to 4 inland. We'll find out. You'll find out as you watch weather reports throughout the course of the rest of the day. What I'm saying now, if you watch this at 9 o'clock or 10 o'clock at night, will be updated by whatever information we have from the Weather Bureau and the various reportings by the various media. But the bottom line is there are more of those coming, and it's very important to understand that we are going to try to keep vaccination centers and testing centers open throughout this period of time. A week ago, the snowstorm that we had that approached 20 inches was an exceptionally large snowstorm, not historically large, but exceptionally large, and in some cases, those will shut down. When we have high winds, for example, the testing location in Glen Island in New Rochelle is an outdoor facility. It's a tent, and we have to take precautions to make sure that we don't lose that asset, and it's certainly not possible for us to continue to do the testing function effectively during high winds or heavy snow in an outdoor facility. The same is true indoors. We closed the county health clinic, which was open last Monday and Tuesday, in respect of the heavy snow that we had that period of time. But we kept it open through Saturday. It does not normally open on Sunday, so we didn't have to make that decision. But in general, we intend to keep these locations open because we have appointments set for each of them. And we encourage you to look at the appointment, follow the appointment. Do not freelance it. Do not just show up or assume that something is canceled. If you have any questions, you can go on our website, westchestergov.com. You can look at our Facebook page, perhaps where you're watching this, Westchester County Government Facebook page. We have a Twitter function that's out there, and we will try to inform you directly and through the various media outlets if there's any changes in plans. I made it a point of going on Facebook more than once yesterday. I was on News 12 a couple of times, WCBS 880, to give updates, and we will try to put information out there if weather conditions are so severe that we have to shut something down. What's coming on Tuesday appears to be very mild. We have some more things perhaps coming over the weekend. We're not sure yet, but it's important for you to stay steady as she goes and understand that only in the most severe situations will we have to shut down these services. And obviously, we're concerned about your health and safety, leaving your home and driving some distance to either get a vaccine or a test. But we're going to try to keep those things open to the greatest extent possible. And you should call proximate to the time of if you have an afternoon test or an afternoon vaccine on a given day, and you want to check in the morning, check the media first, see what's being said publicly, make sure it's an up-to-date statement, and then please go ahead and follow through. We owe a debt of gratitude, as we do after every major snowstorm, and twice this week, to all of the men and the women of our various Department of Public Works. It's the DPW departments and the highway departments all throughout Westchester County that kept the various roads clean. Westchester County government has a fairly limited plowing responsibility. We have to take care of the Bronx River Parkway, which starts at the break in Bronxville from when the spraying goes to the north and the west, and the Bronx River Parkway straight north, all the way up to Kensico Dam Plaza. And that is our responsibility. We're also responsible for plowing out the various parks, parking lots at the parks. Some of them are, used by a variety of different individuals, and then also any of our office buildings. That's our responsibility as a county government. It is your cities, towns, and villages that have done yeoman's work in trying to keep most of the streets clear during these snowstorms, and they've worked overtime and done a heck of a job, and we owe them a debt of gratitude, and you should be appreciative when you see them. You see a guy behind a plow driving a garbage truck, he's probably driving a plow over the course of the overnight or the weekend, and show them that you appreciate it. There's so much about government when things don't go right that people are quick to criticize, but they're not quick to compliment. They just assume, well, you know that I appreciate it. Well, no, they don't. and many of these people put out a lot. They were not with their families on nights that it was cold. It is not easy to maneuver that snow removal equipment, and some people were not able just to drive the plows. They had to do some hand shoveling, and all of that stuff is tiresome and busy work, but it's necessary in order for us as a society to go forward. So we want to thank all those people publicly, and we want to thank the leaders in each of the different local departments. From the county standpoint, I want to thank Hugh Grecian, who's the commissioner for the Department of Public Works and Transportation. And we also want to thank those who work at our county airport, who kept the airport runway open. The runway did not have scheduled flights leaving or arriving, but we must keep that runway open in case there's a distressed flight that needs to land at Westchester in an emergency situation. If they have no further fuel and Westchester's the nearest airport, they have to be able to use that airport to land. If they can't make it to LaGuardia, or they can't make it to whatever their destination is. And so the airport runway remains open, the airport structure remains open, and somebody's got to be out there plowing that airport runway, and we thank those people that were responsible for that as part of our job. And then also those that drive Beeline buses. We were on a Sunday schedule on Sunday with the Beeline buses. We did not terminate service. We did have to terminate it last week when we shut it down for most of Monday and opened it back up on Tuesday midday. But we thank those people. They leave their comfortable home. They come out. They get in a bus. Those buses are not easy to drive. They have to negotiate snow-covered streets. They have to deal with individuals who are sloshing through the snow to take a bus ride. They're not always in the happiest of moods. We owe them a debt of gratitude, too. So I want to make sure that we show an attitude of appreciation. As we get ready to go to questions from the press, I just want to thank those of you who have followed the rules, done the things the right way. That's the only way we get through this. I don't need to make another speech. I've made plenty of them from this podium already. But I've said it numerous times. It's diligence. It's discipline. It's a little bit of self-denial. It's a little bit of forbearance of the other people around us in the world. Not everybody can function at maximum capacity. It's easy to get angry. In fact, it seems that anger seems to be the most prominent emotion in our society today. People are more busy being angry and expressing angry feelings than they are understanding the context of what's happening around them to try to make the best possible result out of this existence that we share at this moment in time. But thank you for your forbearance. We will get through this, and that's what we're trying to do every day, and we're trying to win that race, get the vaccines out there fast enough to enough people, and put the infection aside and move forward, and that's what we hope to do. So I'll turn to Catherine Chaffee, our Director of Communications. Do we have any questions from the press?
Yes, we have one question from Jonathan Gordon from News 12 Westchester. He asks you, the governor said that New Yorkers with comorbidities can begin scheduling vaccination appointments on 2/14, but is leaving it up to the local health departments to determine how, where, and when. What is the county's plan for this?
Well, first of all, Jonathan Gordon from News 12 asked the question. The county's plan is, through our various locations that we control, is to make sure that we are accommodating to those people who get online and set up appointments, and they qualify under the comorbidity structure. Keep in mind, if anybody has underlying health problems, whether it's diabetes or hypertension or COPD, whatever it is, and they're at the age or over the age of 65, they're already eligible. So we're talking about people under the age of 65. Maybe they've suffered through cancer treatments, they have AIDS, things of that nature. They are now eligible, and they should go online, go through the portal, and they're now, I gather, because this is the state's responsibility, they're able to allow you to identify that you have a comorbidity. And once you identify that, you are now then eligible and able to make the appointment. And that is the way we're handling it. We know that the pharmacies have been targeted for people 65 and older. We know that the pop-ups are targeted for certain geographic areas. So we're making available the two that we manage, WCC and the clinic, and through the state, the county center, to be able to accommodate those individuals that go online and make the appointments and so forth. I know it's not easy. It's very difficult. And that is because we don't have enough supply. If you had enough supply when you went online, you would not see a wait until April to get a shot, or March or some other date. You'd see that there was plentiful appointments available because there were plenty of places that had the vaccine. When we have a limited amount of vaccine, we have a limited amount of appointments, and then you get on and you're frustrated because you can't get the appointment that you need. So we're trying to make use of what we have. I mentioned earlier, 1,300 vaccines next week, or this coming week, 1,100 allocated, an additional 200, 20% bonus. Jonathan, that's the universe of what we're working for. So in that 1,300 could be a person with comorbidity. They're now eligible. It could be a taxi driver. It could be a senior citizen. It could be a teacher. It could be a firefighter. It could be any of those people because they're eligible. Who it can't be is somebody who doesn't have a health concern under the age of 65. Those have not yet been authorized. And so that's how we manage it through the appointments process, through the established state format. Local pharmacies are targeting people 65 and above. And as we've seen previously, if any entity doesn't follow the rules that the state has laid down, the state will take away the doses from that entity and reallocate it to some other entities who will follow the rules specifically. Any other questions, Catherine?
That's all.
Very good. Well, we appreciate your time watching. Again, we'll monitor whatever feedback we get. We will try to be as efficient as we can in reaching as many of these constituencies, keeping in mind the limited amount of vaccines that we have and that we also still have a responsibility and function to test. We've been testing, a significant number each day. Just yesterday, the testing number was 9,700 is a round number, and some days we're over 10,000. That's not the county doing the tests. Those are tests that come within the county, done from the various testing locations. So that process is continuing on. And I might add that as a county government, we are still tasked with doing 1,000 other activities. We run a county jail and programs related to the jail. We run sewer treatment services every single day. We have to operate 7 sewer treatment plants, and on and on. The things that are responsible in county government, we try to do those things well and deal with the pandemic as well. I'm George Latimer, Westchester County Executive. Thank you for watching. We will see you again Thursday at 2 o'clock in this location. And if anything comes up in the meantime, we'll communicate back with you on the matter of COVID. We'll have some other things that we'll want to point out tomorrow and other days on other topics. And if there are any press questions, please reach out to Catherine Chaffee. Have a good day. Stay safe.